Hello, everybody. Today I have joining me Dr. Lulu, who's an incredible pediatrician, author, and founder of Tina Life. Welcome.
Hey girl, how are you? Good morning, happy Sunday.
Happy Sunday. So before we get started, can you share an interesting story or something that you have encountered in these years of experience you've had as a pediatrician?
It's only been 30 years, so let me see which of the many, but I think the one that probably sticks out the most is, well, I got two, but one of them was a patient who came to see me 4 months after I opened my first practice ever. She was 9,
Mm-hmm.
and she came because her grandma wanted a second opinion because she just kept having recurring UTIs. And when I just did a basic exam, abdominal exam, and I saw this huge 20-week size mass. And I'm like, wait, what? What is this? And then she told her grandma, she said, I told you my pants don't fit anymore. I've been having to wear my sister's pants. I was like, what do you mean? She said, no, that nobody knew. She's been going to this other doctor who just happened to be Nigerian too. And he just keeps giving her antibiotics. And it turned out that was a stage 4 primitive neuroectodermal tumor that had spread to her lungs.
Wow.
But that is in my head. And of course, the other one was an exchange blood transfusion I had to do in a 9-month-old who had jaundice and ended up dying of kernicterus. Those two
kind of stick with you.
Yeah.
So can you give us a little bit of an introduction? Who are you? What do you do? And, tell us a little briefly about your training.
Okay, so my name is Dr. Ume, aka Dr. Lulu, the malnutrition. I am a board certified pediatrician and a speaker, and I speak on child, teen, and young adult depression and suicide. I'm Nigerian born, obviously, I'm keeping my accent, but I went to med school in Nigeria as well, and then came to Howard University Hospital for residency.
Mm-hmm.
And then following that, I started my practice in the Carolinas. And I was there until 7 or 8 years ago when I sold the practice and joined the Air Force following a divorce. So I came in as a lieutenant colonel, something called a direct accession. And because I was the highest officer in my group, I was automatically made the commander. That's an interesting story on its own, but I digress. And then I did the Air Force for 4 years, got honorably discharged, and then joined the group practice until 2 years ago when I quit. For 2 years until last year when I quit to just do public speaking almost entirely.
That's amazing. Wow. So you spoke about, coming from Nigeria. So let's talk about some challenges and struggles and hoops that you had to jump across and being a female in the medical field. Can you give us a little bit of insight into that?
I mean, we were, I guess, the minority of the minority, so to say. Female. There was maybe, when we first started, 120 kids, and in the end, only 60 of us, or maybe 40 of us graduated. And of the 120, maybe there were 10 girls. And then of the 44 that graduated, maybe, 6 girls. So we're definitely the minority. And then me, because I'm from the southeast part of Nigeria, I was that much more of a minority because I went to school in the northern part of Nigeria. Coincidentally, there were 2 or 3 of us from my tribe, which is just weird, in my graduating class. So I might have the numbers wrong. It's only been 30 years, but certainly there was minority. I wouldn't say that it was a huge struggle. I don't know if you're Indian, but I usually use the country India as my prototype for a patriarchal society, the ultimate patriarchal society. I use India. Nigeria is next to that, maybe even the same. But I want to say Nigeria, maybe not as bad. My home was not as bad. I was raised by, both parents. My dad was in the Air Force, and he was definitely pro-education across the board. But he still had the Nigerian mentality of, well, you're a female, you shouldn't do medicine. Like, that's for men. You should do pharmacy, he said. Something like that. No, I wanted to do architecture. Then he said, you should do, something like pharmacy for girls, like your cousin. And I was like, wait, if I'm going to do anything, then I might as well do medical school. So he was like, what? I said, yeah, I'm not going to waste my time doing pharmacy school. I kind of looked at pharmacy like, not for me. And so I went to med school because I wanted to. And my dad was like, okay, we'll see. And then I was like, yeah, we'll see. And then I did. But it wasn't too bad. I think you just learn to, I'm the first of 6 kids. So I learned to speak up, because I'm the first. And then I just didn't have too much fear because I was like, I'm going to talk my way out of it. Unfortunately, or coincidentally, I was bullied by a bunch of kids for a long time when I was young. And I just didn't say anything. I just hated getting on the school bus, but I didn't say anything. Not because I couldn't, but not because I wouldn't, but I just couldn't. Is that the word? Yes. I just couldn't because there were too many kids. But other than that, graduating was, it was good. It wasn't too bad. In the classroom per se, it wasn't too bad. But outside of my class is Nigeria. And then, of course, you need to, what do you mean you're going to college? Why? You need to get married and have kids. Like, why is father wasting all that money on education for you? You're a female, things like that. You would hear things like that. Not too different from America, where people always ask me, they call me nurse first, or they say miss before they say I'm the doctor. Even after that, it's still miss, like, what do I have to do for you to call me, address me by my proper name or title? So it's not too different. America is not too different. We have inequality of wages. It's the same thing. We have to fight for everything and then some. So it's not too different. When I was getting the job I took after the Air Force, my then 17-year-old son, who is now a senior at Stanford, he said, Mom, on my way out, I said, Mom, I said, what? He said, don't forget to negotiate like a man. I was like, what do you mean? He said, Mom, if you were a guy with almost 30 years experience, how much would you ask for? I was like, oh, nearly 300. He said, then ask for that. I was like, okay, but something like that. So it's not too far from Nigeria in America, honestly.
Okay. So how was it coming as an international medical graduate, having to go through residency? And can you shed a little bit of a light on that for us?
That was probably interesting, just in the sense that I was, and I don't know if you're Persian or Indian, but
Afghan.
Yeah, what?
Afghan, from Afghanistan.
Okay, so I kind of sense that, but so I don't know if you have a British colony or not, if you were colonized by the Brits or not. So coming here, my biggest challenge, first of all, I only knew America through the pages of Jets magazine and Ebony magazine and those magazines, and of course movies. And you just think, when they show you the homeless, you just think it's a movie set. It's not real. Then I came through New York. I'm like, wait, it's real. Like, oh my God. And then people ask you, how do you learn English? Like, do you guys speak English? Or, do you live on trees? Like, they can't get the fact that we have cosmopolitan cities in Nigeria, like Abuja and Lagos and Enugu, and they can't wrap their head around that. Like, really? I'm like, yes. We don't speak my language in my home. My parents speak my language to each other. And I learned it because I love to speak languages. I speak 8 different languages. Most Americans don't speak more than 1. I'm like, no, because I have a personal interest in communication specifically. So I speak 8 languages fluently. And they're like, what? Yeah. I didn't have to go to special schools. I went to public schools. I didn't have to have a chauffeur. No, yeah, we do have a chauffeur, but I wasn't like an exclusive, like, big man's child, I think, because they think, oh, your dad must have, no, he wasn't very rich. It's just the way we do it. I went to boarding school. Oh my God, really? Yeah, but it was a public boarding school. It was, government owned, but they just can't wrap their head around it because the narrative of the average immigrant or foreigner is negative, as we see right now playing out through the White House. So it was a bit of a challenge more for them accepting me as advanced above them. For me, my own problem was I had to get with the lingo. Like we say torch light, we don't say flashlight. And I was like, what? Or the trunk of a car, we say the boot of a car. Or we didn't have amoxicillin, we had ampiclox or ampicillin. So I had to learn the word for diaper is diaper, because back home we call them nappies or napkins. So little things like that, just the little things for me. And then just facing the fact that every other 16-year-old had a child, they were pulling baby strollers. I'm like, why? Because in my country, we're all we're in high school, we're getting educated. As you know, Nigerians are the most educated people in the world. So we get educated. I'm like, what do you do? What do you mean that's your kid? I'm like, oh, you have 3 kids. And you're 19. And they're asking me, like, why don't you have a kid? I said, because I'm not married. Like, because I have a plan for my life. Like, so it was equal, them learning me and me learning them, but more so them, because I just laughed at them like, yeah, I have an accent and I love my accent, by the way. You have an accent. Do you not know that? They're like, no, I say, yes, you have a New York or whatever state you're from accent. Like a Texan doesn't sound the same as a Tennessean or in New York. And you don't know that, that's a problem with you. So it was a lot of ignorance on their part. And then I just having to just accept it and fight everything in my power that, oh my God, let me not regress with these people that are so ignorant. So yeah, honestly, that's my story, and that's literally my story, and I'm sticking to it.
That's incredible. Wow. So, I mean, this is pretty amazing. You said that you speak 8 languages. That's pretty amazing. So where I come from, we're very multilingual as well. The majority of people, there you go. Majority of people speak about, the average is around 3 to 4 languages. So tell us a little bit about the different languages you speak and how did you pick them up?
Well, so my dad was in the military. He's a retired 2-star general. So we moved around a lot. Even though I went to boarding school, I didn't move for those 5 years I was in high school. But in my high school, there were kids from all across Nigeria. And I just have a knack for languages. I never even knew the word was polyglot until my now, senior son told me. I was like, oh, okay. I just say I speak 8 languages. But I just love that. I took French when I was in kindergarten. I started taking French when I was in kindergarten. And I love that. And so now I speak Spanish and French, and English is not my mother tongue. And people forget that. So that's one of the languages that I speak. And then my natural tribe, which is Igbo, and then Hausa, because I grew up in the northern part of Nigeria where they speak Hausa, but then we lived in the west where they speak Yoruba. So you see how I learned that? I just learned. And then I had friends, and I asked them, how do you say this in your language? How do you say that in your language? And I want to say it exactly the way. So when I was learning Spanish in the Air Force, I made sure I didn't learn medical Spanish. I learned street Spanish, because my average patient comes in telling me a story about how their day was last week. And my job is not to just say, oh, tiene dolor. No, they want to say, ayer en mi casa, like what happened yesterday in my house, or last month or last week, the story, we are connected by our storylines. And for me, it was more important that I understood the story behind the sickness. And so I ask people to, doctors especially, medicine is so much more of an art than science. It's an art, period. It's an art of listening and talking and understanding and empathizing and having compassion. So when the little son tells me the mom is talking for 5 minutes and the boy says, she says she has a headache, I'm like, no, what did she say? Well, I mean, she said our dog came home with, I said, I want to hear that, so I was like, you know what, I'm just going to learn it. And so that's what I mean by medicine is so much more of an art. And when I was in the Air Force, when I used to work with the residents, I told them, I said, residents, learn to listen to the patients, the words said and the words unsaid. Because sometimes the words unsaid is where the answer is, I get passionate when I talk about that.
I feel your passion. I think that's absolutely incredible. So even if we speak one or two words in our patient's native tongue, I feel like they trust you more. They feel like they can confide in you so much more.
You took that from my mouth. I don't speak much more than salam alaikum. I don't speak much more than that, and malaikum salam and a couple of other words here and there. But I went to school in the northern part of Nigeria where they're predominantly Muslims. And I insist on saying salam alaikum when I walk into the room with someone wearing a hijab. I don't care who's around me, because right away I'm a friend. And it's important to me that they see me as a friend. And that's nonverbal communication. She doesn't have to say, and I don't have to say anything else in Islam.
Yeah.
As long as I say salam alaikum, I recognize the light in you, and you see that I am trying to show you my light. That's it. And after that, we can say whatever, but she or he will recognize me not as an infidel, but as a friend. And to me, that is all I needed. And their kid, they would eat out of my hands, because I came and I recognized that both of us are foreigners. We're both in this country. We're trying to survive. I might have a white coat and you have your dress on, but if we meet outside, we're both in the same category. So I need you to see that I see that. And I want people to understand that. When I knew I was coming to San Antonio, I had to learn Spanish. It was like a no-brainer, because I don't want anybody to tell me what's going on and I don't understand. I want to know everything that they're saying. I'm that nosy, you know? But it helps me a lot with my communication, and my patients are so comfortable with me because I'm just like them. I'm just wearing a white coat today, you know?
Absolutely. I think that's so beautifully stated. So let's talk about, being a pediatrician. How long did it take you to become a pediatrician? Did you do a fellowship? If so, what was that?
I just did a residency. I swear to God, when I was younger, the younger version of me, even before I knew I was going to be a pediatrician, my friends always used to tell me, oh, you just have to be a pediatrician. Or when they said a kid's doctor, because I would see a child and I would literally gravitate to the kid. I'm walking down the street in the market when I was in med school, and I'll stop and ask the lady if her child has sickle cell, because I see the eyes and they're like, how did you know? Or one time I was talking to a bunch of teenagers recently at the YMCA, and I asked the kid, I said, dude, how bad are your allergies? He was like, how did you know? I said, look, after 30 years and I can't see that you have allergic shiners and you're doing the allergic salute, then I taught him that. And he was like, cool. The single most important word a teenager can say to an adult is cool. And I got that word from him because I recognized he has allergies, something so simple. So I tell people that when you cut me, I will bleed pediatrics mixed with red blood, because I love being a pediatrician. It's just like I was born to be a pediatrician. I just can't think of me doing anything else. I love it to pieces. I did a telemedicine visit this morning, and at first I said, she has Down syndrome. And I was like that, like, she has Down syndrome. And the dad was like, oh my God, most people say, oh, she has Down syndrome. Or what, it's like a negative connotation. But I was like, she has Down syndrome, like, and he was like, right away, he called his wife to come and see this doctor who's like a friend. Mm-hmm. Communication is the key. It's the key. That's why we go to wars or don't go to wars. That's why we get divorced or don't get divorced. Communication.
Absolutely. Well, you brought up a really good point. Let's talk about telemedicine. And as a pediatrician, how are you using telemedicine?
I quit my job as a pediatrician about a little over a year ago, because of the work that I do now, which is speaking about child suicide. But before I did, the lady I was talking to, my coach then, and just kind of introduced this idea of, so what are you going to do in the interim? I was like, I don't know. So she was like, well, you could try telemedicine. I said, telemedicine? No. She was like, well, how about you speak to so-and-so? She's doing telemedicine. I'm going to give her a shout out. Her name is Dr. Una, because she might see this. She's a coach. And then the other lady was Elizabeth Onuva, I think is her last name. I forget. Anyway, but she was like, why don't you speak to her? She's doing telemedicine. Maybe she'll show you the ropes. I was like, okay, reluctantly. And then Elizabeth told me, and I was like, all right, I'll try it. So I put in my paperwork. And then within 6 to 8 weeks, I got approved or whatever. And that was about 2 weeks before I was done with my time. My time was up with where I was working. And so it was a smooth transition for me. And I've loved it to pieces. And I tell people all the time, I go everywhere I go. Well, I know that's my picture, but everywhere I go, I have my telemedicine with me. I went to Bali in May and I had telemedicine. I went to Singapore in January and Vietnam and I had my telemedicine. I was 13 hours ahead and I had my telemedicine with me. I love it to pieces. It's a lot of talking, which I love to do anyway. And then if you get a video call, you get to see the kids. Sometimes they come and show you their little toy train or their little pet dog or something. Mm-hmm. But then again, you have the option to do just a phone call. My only struggle with the telemedicine, which I'm going to mention it now, is a lot of the parents have this idea that I'm just going to call the telemedicine doctor and just get me some antibiotics because my child has green mucus and it's a sinus infection. So I always take a deep breath. One day my son came to me and said, Mom, I know everything. I know all the spiel now. Because every single other patient, I'm telling them, no, it's a virus. It's a virus. Some get pissed. Sometimes I get pissed because then I say, look, I'm human. What you ain't finna do is cuss me out or talk junk to me. Do you know from whence I come? The truth is, your kid does not need an antibiotic, period. You're not going to get it from me. And sometimes they hang up and then they call back. And then the next doctor, who is a chicken, I'm going to say, gives them the antibiotic. Green mucus is not anything. It's a natural progression of a cold. But then over the years, people, doctors, mid-levels have told them that it means it's an infection. I'm like, what do you mean? It was always an infection. And just because your throat is red doesn't mean you have strep throat. The AAP actually does not recommend you diagnose strep visually. It's on their website. And so I've been very thankful to God that I'm able to teach another group of people that I will have never met. The badness is what I'm going to use. The badness of overprescribing antibiotics, which what's his gentleman's name? Alexander Fleming. In 1923, when he discovered penicillin, he predicted there. He said, I'm just going to paraphrase it, woe betide the doctor who dispenses small enough doses of this penicillin that the bugs become wiser. His own words. 30 years later, how many years later, look at what's happening. The bugs are beating us because he said it. He saw that they can get wise enough to beat this antibiotic that kills them. And when he said small enough doses, he meant just over prescribing it when you don't even need it, and then your body doesn't need it, and you get side effects from it. My friends who practice medicine in UK laugh at me every time I tell them that we still treat ear infections with antibiotics in America. You shouldn't. Your body will take care of it. Most Americans look at me like, yes, you are a voodoo doctor when I say that. But have you tried waiting and see that your body did not take care of it? No, because you quickly give an antibiotic. And that's another thing I'm very passionate about. I wrote an article about it for Kevin MD. It's also on my blog. And it got so many shares, and it's still very, very, very relevant because people will not hear to not prescribe antibiotics. Telemedicine should not be convenient medicine. It should be good medicine, regardless. And so I dare to say that I practice good telemedicine, regardless. You're not going to get an antibiotic out of me if I don't feel like you need it. And guess what? Been doing it for a year, knock on wood, haven't had any trouble yet. No one has died. All my patients when I was in private practice, none of them died because I didn't give them an antibiotic. Never been sued. You know what I mean? Like, good medicine is good medicine. And if, as a doctor, you must teach, you must assume the role of a teacher, a parent coach, an advocate for your kid, your patients, because they don't know any better. Their mom is giving them antibiotics every month. I have patients on telemedicine that have had an antibiotic for the last 4 months, last 4 visits, 4 months. And then they look at me like, yeah, but the other doctor gave it to me. And I'm like, yeah, I won't. And you know, the art of public speaking, you learn to change your tone or that pregnant pause and say, yes, ma'am, you're right, they gave it to you, but I'm not going to give it to you. Very matter of fact, no shaking, like they say in Nigeria, you know, You're not going to get it because da 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 da. And many of the mothers, thankfully, come back and say, thank you for educating me because they didn't even know.
Mm-hmm.
Girl.
That's amazing. I think it's absolutely incredible. It's something that we all need to be more cognizant of. And we encounter that. I mean, on a daily basis, we go to the ERs, and all people want is antibiotics. They have a cough, they have something. It's like antibiotics. So
and they know their child. I know my kid, and you know what I tell somebody wrote this when I posted something about this antibiotic use recently, and someone on Facebook came back with the perfect response. She said, "You know your kid, but you don't know the bacteria. You don't know the bug. The bug is smarter than all of us put together. And because you don't know the bug, because I am the final frontier between your kid and another dose of antibiotic that they don't need, I must make the right decision."
Absolutely. That's what is good medicine, like you said it perfectly.
You know what? Let's call it great medicine. They're not enough of us. And my friends tell me all the time, I just wish I lived closer so you could be my kid's doctor. Because honestly, I keep it real. Like, I'm not gonna mince words. I'm too old for that. I'm 50 plus, I've been doing this for a long enough time. There's no new diagnoses that have come up in 30 years. No, I might not know the latest technique of doing some fancy technology, but ultimately our patients come to us for two reasons. Yes, for their kids to get better, but sometimes it's just to hear someone tell them they're not crazy. They've got it. They're doing the right thing. You're a good mom. It's okay to worry about your kid, but then allow me to tell you the right thing. Because the truth is, it's only in medicine that parents have assumed this role of, I know my kid. If you, my dear doctor, went to the accountant, you are not going to tell the accountant, I know my numbers. If you went to see the lawyer, you will not tell your lawyer, this is how you defend me. No. Your lawyer tells you this is what you're going to do, and that's what you're going to say. And you say, yes, ma'am. But when it comes to medicine, we have just been trampled upon so much. We lost our mojo. We're chickens. And I'm going to say it because it's true, it's better that. People, the doctors, the providers have just they don't want to tell the patient no. And you know what? It's because they've clipped our wings. You're worried about your Yelp review. You're worried about the patient going to the next doctor and getting that but you know what? I sleep every day at night, muy bueno, because I was good with that patient and I did what I know, first do no harm to that patient.
Absolutely. Absolutely. So let's talk about some advice that you would give to young girls who look up to you, who want to follow in your footsteps, or even just anyone who wants to become a pediatrician. What's your advice? What are some of your tips so that they can become excellent physicians like yourself?
I would have said I've given all the tips this whole time. Be true to yourself. I would tell my younger self is what, like when my son was my guest on my podcast, and I asked him, I said, what would you tell your 12-year-old self? He's 21, and he said some words just blew my mind. He said, I would tell my 12-year-old self that you're going to be just fine, because he was being bullied, and I always get emotional because he's my first fruit, and he said, you're going to be just fine. So I have to say to the younger doctors coming, you're going to be just fine. Stick to your guns. Don't let anybody tell you can't do it. You can. You are becoming a better version of you every day. You can't see the future, neither can I. And I tell my parents that. You can't see the future, and neither can I. So for today, here's what you're going to need for your kid. If tomorrow comes and your kid is worse, go to the ER or see his doctor. So I tell the residents coming up, yes, medicine in America, we've been battered and beaten up, and we're leading the pack in suicide. Female physicians are leading the pack in physician suicide because we're so pulled in so many directions. Remember to take a break. Go take a break, get a breather. I have a brand new practice that I only see high-risk teenagers because I speak on child suicide and depression. And my schedule is Tuesdays, Wednesdays, and Thursdays. Mondays and Fridays, I do my podcast, I live my life, whatever. And I had a mom recently who was like, well, I want to come on Monday because that's the only day my son does not swim, and that's the only day I'm off. And I took a deep breath and said, ma'am, I'm not open on Monday. If your son is truly suicidal, which is what she said he is, you're going to come see me when I'm open. You don't argue with Home Depot when they close at 6 and you walk in there, you go there at 7. No, you go back the next day and you make sure you're not there after 6. If your doctor, who is a male doctor, I might add, white male doctor, tells you, we open Tuesdays, Wednesdays, and Thursdays, you're not going to argue with the doctor. But sometimes women are our own selves' worst critics, worst enemies. We're like crabs in a pot sometimes, you know? And I didn't go into all that detail. I just told her matter of factly, ma'am, we don't open on Mondays. We open on Tuesdays, Wednesdays, and Thursdays. And I didn't even go into the details of why. I just said, that's our hours. I'll be glad to see you from this hour to this hour, and I will give you the best of me, because that's how I am. I come full throttle every time. But I'm not going to see you on a day that I'm not supposed to be in the office, because then I'm going to get burned out in my own doggone practice. And I don't want that. So for the young doctors coming up, know your weaknesses. Learn your weaknesses. Learn the things you can't do, because your strengths usually will come through. The weaknesses are the things you want to kind of come face to face with. That voice inside your head telling you you're not good enough. The one that looks like you and sounds like you and goes to bed at night with you. That is the one. Fear, shame, those ones. You have to look them in the face and say, not tonight, not today, be gone, so that you can live your best life, because they're with you everywhere you go. But just like any kind of learned behavior, learn to be kind to yourself. Learn to appreciate yourself. Give yourself a wink. The other day I went to the bathroom at a doctor's office where I was going, to fully market my brand new practice, which is going to be a month old tomorrow. And I walk in and I gave the girl my spiel, and she was like, I'm going to get the office manager because I think it's whatever. I think you need to see her or whatever. And I said, may I use the restroom? And I walk into the restroom, and normally I will just start looking at my wrinkles or my skin color. But I walk into the restroom and I gave myself a wink. I said, girl, you got this, And I came home and I told my wife, I said, guess what? I said that to myself. I've never said, girl, you got this, man. You're killing it. I said to myself. I felt so good. I want us to start doing that. Tell yourself, you're killing it, girl. You look good. And know that God answers prayers. And sometimes his answer is not yet or no. I have something else for you. And so when those failures come, look at them as a chance to learn. People say, fail forward, fail forward. I agree, fail forward, whatever. I accept the failures as maybe this was not the way to go. And so what do you do with your GPS? Make a U-turn if possible. Make a U-turn if possible, right? So make a U-turn when you get that failure. Go back to the drawing boards and see, okay, what did I do wrong? And accept your role in it. I've had a failed marriage, and I've had to come to terms with the fact that maybe I wasn't the bestest wife either. I had my own private practice. I saw 40 to 60 patients in my practice. Maybe I didn't give him enough nurture. So what do you think I'm doing with this marriage now? Honey, I'm doing my best to make sure that I'm the wife that I would have liked to be. You know what I mean? Or like that I would have liked that. I don't know what I'm saying, but you know what I'm saying. I want to be that wife that I would like to be. I think that's it. But anyway, the bottom line is just know yourself. When you look in the mirror every day, wink and nod and say, yes, today is the first day of the rest of your life. I don't know if you guys in Afghanistan, are you from Afghanistan, you said? You guys have lizards, the big agama lizards. Do you have those? The one with the red neck? Well, in Nigeria, we have those. They're tropical lizards, I think. So when they fall from a tree, they nod. And so in Nigeria, we say that, yes, the lizard praises himself that, yes, another fall, and I landed on my feet. Way to go, girl. So I say to people, remember that and nod and say, I got this. So you got this.
Yes. Absolutely beautiful. Well, thank you so much, Dr. Lulu, for your time, for giving us so much insight about all these experiences. In the next video, we're going to talk about the very important topic of suicide because I think that deserves its own, video and time, and I don't want to squeeze it into like 5 seconds. So once again, thank you so much. It's an absolute pleasure to have you join us and share all of these insightful thoughts. And I mean, I feel so blessed right now. I feel empowered by you, by just listening to you. Your passion is absolutely incredible, and it's truly an honor.
My honor. The honor is mine.